Can you please talk about Lamotrigine versus sodium valproate? I think it's best that each of these meds get their own video, so this one will be for Lamictal Lamotrigine. This is Lamotrigine. This is what it looks like. Now, Lamotrigine was originally used as an anticonvulsant medication. It covers generalized tonic-clonic seizures, partial seizures, complex partial seizures, and it's a first-line anticonvulsant medication. Now, I don't treat seizures, but I do treat bipolar disorder. And Lamotrigine is FDA approved to treat bipolar 1 and bipolar 2 disorder. And there are many reasons why I like Lamotrigine, and there's a few things that I have to be careful about with Lamotrigine. So one thing I really like about it, no drug monitoring and no monitoring of any kidney or liver function. With lithium and Depakote, you have to monitor the level in the blood because if it's not accurate, it can cause toxicity. And you have to monitor kidney function for lithium and liver function for valproate, among other things, because they can have pretty nasty side effects. Lamotrigine, thankfully, does not cause that kind of long-term damage or long-term monitoring. The other really nice thing about Lamotrigine is that when somebody is on it for bipolar disorder, it has been shown to reduce the risk of depressive episodes. The one thing Lamotrigine is not really good for is when somebody's actively manic. And I think the real reason why is because you can't titrate, meaning you can't increase the dose of Lamotrigine quickly. And this goes into the reason why Lamotrigine, some things you have to worry about. There is a rare but very dangerous and life-threatening side effect of Lamotrigine, and that's something called Stevens-Johnson syndrome. Stevens-Johnson syndrome is your body having an autoimmune reaction to your skin. And what it often looks like is a burn, but it's like an autoimmune mediated burn of your skin. And if untreated, it could be deadly. Now, the way to avoid this with Lamotrigine is one, to counsel people that when they start it, to make sure they look at their body and see if there's any rashes forming, because it starts with a rash. If there is, we immediately discontinue it and continue to monitor. Now, 10% of people have a benign rash, but it is impossible to tell if that's a benign rash or a Stevens-Johnson's rash. For that reason, Lamotrigine is titrated up very slowly. I mean 25 milligrams every 2 weeks. And an effective dose of Lamotrigine is up to 200 or 300 or 400 milligrams a day. As you get to higher doses, you can titrate a bit faster, but in the beginning, you go very slow. The other issue with Lamotrigine is that if you miss 2 consecutive days, you have to start from zero again. This is getting long. Let me know if you have questions below.